So what is the role of a pediatric dental clinician? And each of us are going to interpret it differently for ourselves and what works for us. So there isn't one. But if I put it all together, one of the roles is, I think, being an advocate for kids. I think one of the roles is thinking about the impact in the community and policy. I think one of the roles is being a great clinician. I think one of the roles is being a specialist. I think one of the roles is thinking about population health. It doesn't all have to be done by the same person. It has to be done by a variety of different people, each sort of with their skill set. How do we share information? How do we share data? How do we use our practice management system in a very different way? So the opportunity, because of technology, because of the resources, and frankly, consumer interest, has never been better. I mean, I think it's an incredibly exciting time to go into dentistry. If your definition of success is how much money you make, that's one definition. If your definition of success is how healthy do I get this population, that is another, but you can't do it without both. No money, no mission. And you need to make sure that people are appropriately compensated, rewarded, engaged, and engaged by all the things that they do together, and all the psychic rewards, all the reasons people think about what they do every day. Money matters, and I don't want to minimize that. People have to get a good income, be compensated for what they do, whether you are the front desk, the hygienist, the dentist, all of it. But thinking about it in a different context. People have a very amazing ability to respond to incentives, and that's all of us. And if you pay us to do something, surprisingly, we'll tend to do it. The conversation that all of us that are involved in financing are having right now is, how does one move from a fee-for-service system into some other kind of a system? And that is a huge question. I think it's particularly challenging right now in dentistry, and I use dentistry and not oral health in this deliberately, because most people are paying some or all of their dental bill. If I take the medical system and compare it a little bit to the dental system in terms of reimbursement, for many, many years, medical was paid a fee-for-service. And essentially, for most, in many ways, it still is. The difference is you're seeing all kinds of experimentation in either quality contract or affordable care, but it's at a global level. So you've got to be part of a global group or a big primary care practice, because you're still taking a responsibility for a population of patients. It's very difficult to do in medicine, as it is in dental, one by one. It's a partnership. And I truly mean that. I mean, giving information back and forth is absolutely where we're going to go in the future in order to improve oral health of kids. Without information, without data, without an understanding, then you can't even have a conversation.